Alcohol use disorder, risks, barriers in treatment, and harm reduction. The risk factors for the development of alcohol use disorder and other substance use disorders include personality characteristics such as impulsivity, behavioral disinhibition, psychiatric disorders such as ADHD and anxiety disorders, or family environments such as living with somebody who has substance use disorder or living with abusive or negligent parents. Adverse childhood experiences, or ACEs, have been examined and researched, and evidence shows us that these potentially traumatic events can contribute to negative long term effects on individuals, both physically and psychologically. ACEs can impact emotional regulation and modulation, which could result in individuals seeking substance use as a way to cope and alleviate distressing emotions. This could explain the relationship between ACEs and SUD, and a higher rating on ACEs scale could increase risk for developing SUD. People who have social vulnerabilities are also at an increased risk of developing alcohol use disorder. This includes individuals who experience race or gender identity discrimination, as well as individuals with mental illness or who are experiencing houselessness. In one study, it was found that there were higher rates of alcohol use amongst transgender patients, though the research itself was flawed since appropriate alcohol use continues to use gender-based metrics to determine appropriate volumes. Moreover, individuals who fall under the LGBTQ umbrella are at an increased risk of co-occurring mental illness due to social stigmatization, which further increases risk and likelihood of substance use problems. Co-occurring mental illness is both a risk and a barrier in treatment for alcohol use disorder. Specifically, individuals experiencing mental illness will sometimes use alcohol and other substances as a way to cope with negative symptoms of their disorder. Those who are experiencing mental health problems may find accessing treatment and navigating the healthcare system prohibitively difficult and may abandon attempts at seeking treatment much more quickly. Rates of substance use disorder also appear highest amongst individuals with dual diagnoses, such as autism spectrum disorder and ADHD. Those who are experiencing schizophrenia are also at an increased risk and face more barriers, in part because they may experience extreme social isolation and poverty. This is called downward drift theory, and it is an indication that there needs to be much more support in place for extremely vulnerable individuals, such as those experiencing schizophrenia. The family system can play a crucial role in recovery and decrease likelihood of relapse. Family-centered interventions and therapeutic treatments impact the behaviors of individuals with alcohol use disorder. Particularly, family behaviors that are supportive in initiating recovery can increase the likelihood that the individual will seek treatment. These behaviors include reinforcing positive attitudes towards sobriety and cessation of drinking, ignoring negative behaviors associated with alcohol and drug use, and allowing the individuals to experience naturally occurring negative consequences of drinking while requesting specific and positive changes in behavior related to drinking, such as treatment and change behavior. With family support in place, the goal is for the individual with alcohol use disorder to reevaluate their relationship with substances and come to decisions about their behaviors naturally. CBD, a cannabis product, also has potential as a harm reduction treatment for those with alcohol use disorder. In mouse and rat studies, it was shown that CBD helped to decrease motivations to drink, decrease impulsivity, and decrease overall consumption of alcohol. Additionally, CBD has strong antioxidant and immunomodulatory characteristics that may help improve and protect cognitive function, as well as helping liver function and reducing inflammation. In a self-driven treatment program for individuals experiencing both houselessness and alcohol use disorder, it was shown that harm reduction approaches better serve this community and had more positive outcomes when compared to abstinence-only models of treatment. The program focused on strength-based reflections and affirmations, wherein participants felt more empowered and in control of their progress and outcomes, leading to decreased harm related to alcohol use, increased program engagement, and overall decreased consumption of alcohol. Harm reduction approaches to alcohol and substance use treatment are evidence-based and backed by research. It is a non-judgmental, non-moralizing way of helping people with substance use problems in having agency and making positive changes for themselves. Each individual's goals are respected and treatment is self-driven.